let's talk a little bit about how fat is used and where it's used most traditionally. Talk to me a little bit about where a patient might have fat re-injected, reapplied.
Fat is very powerful, as you said, and fat is back in. Fat is in. The science of fat. I mean, the use of fat dates back to over 2,000 years ago, where fat was used to even reconstruct breast at a time or put into deformities, areas of what we call contour deformities. But over the last 20 years, we have refined the science of fat. Now we know how fat behaves. And we are utilizing this power of fat to do so many amazing things. Recently, the Department of Defense gave a grant to the University of Pittsburgh to study the use of fat in reconstruction after post-war, post-war deformities. But for the cosmetic purposes, I mean, we are using it to fill in defects. So we are using fat to elevate the eyebrows, to a brow lift. This is a non-surgical brow lift. We are using fat to do what we call tear trap deformity. When people have hollowness around their eyes, now we're not going to take the fat out. We are adding more fat to camouflage because fat is good. Fat gives us the youthfulness in our faces that we see. If you see any attractive little girl or any attractive little boy, it's because they have very fat, nice fat design around their face. So we are utilizing the power of fat to achieve all these things as we age. We are using fat to even build the bridge of the nose for people who have what we call low radix, especially African Americans and Asians and Latinos, people who have had a bridge problem. We can add fat to it. Okay? We can also add fat to our laugh lines. We can add fat to our lips. We can add fat to our chin to augment the chin. So there's nothing we can't do with fat these days. But some of the most common uses of fat is, as I described, along our laugh lines, underneath our eyes, and now we are utilizing fat for breast reconstruction. Breast reconstruction, after mastectomies, we are utilizing fat. We are utilizing fat for primary breast augmentation. We are utilizing fat, for women who have what we call involutional changes. They've had children, they've lost volume in the breast, and now, they don't want an implant. So we take the fat and we put the fat back into their breast.